Segment of the day. Now this actually comes from one of our viewers.
Okay.
Name is Beth, who goes by the Instagram handle of Rubbing Buddha's Belly, which I thought that was pretty funny. I like that.
I like that.
Rubbing Buddha's Belly. So she wanted to know about thread
I have a funny
facelifts.
story about Buddha after this.
Oh, do you?
Yeah, I can tell you now or later. It doesn't matter.
We'll save it. We'll save it. So she wanted to know about thread facelifts. And I was like, oh, that's actually a really good topic because we've never talked about those. We've talked about almost everything else, but thread facelift is something that we have not. And so I want to educate people about what is a thread facelift. Have you guys heard of this?
You've talked about it before.
Have I? Oh, I thought. Oh, maybe it's like in passing.
Yeah.
Yeah. Have you? So, Travis, you've heard of the thread facelift?
No, I've not heard of the thread facelift.
Okay. All right. So.
Yeah.
So a regular facelift obviously is where you make cuts and you tighten everything inside and you cut out some of the skin, close everything up, right? So it's surgery, right? There are non-surgical treatments for facelifts. And the one I always talk about is I talk about the halo laser, which I love. Yeah. And then the Morpheus 8 is also a very good one. That's a microneedling radiofrequency energy tightening. But another alternative to that is this process called threading. And it is a minimally invasive procedure, which as we just talked about in the earlier segment, those are completely on the rise. And this is a procedure that takes a barbed thread or suture and places it through the face, and then it has barbs on it. So once you place it into the tissues, it catches, and then you pull it in the direction that you want to tighten the face. And so you have these little needles, and it's got the threads cannulated. I think I have a picture of that. Yeah, there it is right there. So you put that little needle under the skin, and once you get to the ends, you can pull the needle part back, and then you can pull that thread, which when you pull it, as far as you pull it, it catches because it's barbed. It's like a fish hook, but it's like a rope full of fish hooks.
Yeah.
And so when you pull it in the tissue, it catches and it holds that tightness. And that is the process of threading.
That
and
seems very painful.
I mean, you do have to get some numbing for it.
It's like a micro thing, right?
Minimally invasive.
Well, like
the size of the thread. Yeah, they're not big. It's not like a rope. I mean, it's. I would compare it to like sutures. It's probably like a 3/0. I know that means nothing to you. I mean, it's like fishing line.
Okay.
Yeah, about the thickness of fishing line.
Cool.
And also, it has the structure of fishing line because that's a monofilament.
Is it like bendable and stuff?
Right.
Yeah.
But like you know how rope is braided?
Yes.
Okay, and fishing line is smooth.
Mm-hmm.
Yeah. So we call that monofilament versus like a braided. So it is a monofilament. It's PDO, which is actually a suture I use in surgery. PDO is a absorbable suture, but it's a long-lasting absorbable suture.
Okay.
All right. So over time, it does dissolve. It goes away eventually. Your body dissolves.
Interesting.
Well, yeah, it's not permanent. It's not a permanent suture. And here's where some of the downsides come in. The variability of how long that suture stays before it starts to break down. Because once it breaks down and snaps, like it's gone. You know, your effect's gone, right?
What if you had like one side of your face is like?
That's a good question, Sarah. You're very smart. So it lasts 6 months up to the longest, 1.5 to 2 years.
Yeah. How does it like stay tight? Like, is there like some type of like?
Because it's barbed. Like, so you put the suture in.
When they pull it to where they want, there's nothing that makes it like, like stay.
The barbs make it stay.
Okay.
So imagine if you.
So it's like it just like locks in place.
So most suture, I use barb suture when I close like my tummy tucks.
Yeah.
Because what it does is it resists the body pulling it apart. The barbs hold everything together. In this instance, you're running the barbs through a piece of tissue, but you're pulling it, and what happens? It's almost like it purse strings. Where those barbs are, it catches and it pulls. But then when you let go, it doesn't snap back because the barbs hold it in place. The barbs are what keep it locked in. Yeah. So you have to prep the face. You have to numb it. You use the cannulas. You put it in and you pull it. So there's some artistry in this, and you have to know which directions to put it in, which layers of tissue to put it in, how tight you want to pull it, and so there's a bit of user I don't want to say error, but like user technique determines outcome with this very, very commonly. And what's interesting about threading is I don't know I've ever met a plastic surgeon that does threading.
Yeah, immediately I'm like, I feel like I would rather just get fillers or just like more Botox or something.
Yeah.
Or just like an actual facelift.
So I'm going to go over the pros and cons of this. And I don't want people to think that since I don't do this, I'm not automatically going to say it's garbage, because I'm not saying that.
Garbage.
But I'm going to be like very honest about the pros and cons of this. I think that there are good reasons why you don't see this in a plastic surgeon's office, which, I mean, I know I'm a plastic surgeon, so you might think it's biased, but I do think plastic surgeons are far and away the experts on knowing what procedures are going to make you look younger. I mean, we have more training than anyone, and it's basically our whole career.
Yes.
And there's a lot of certification law. So, I mean, I would consider us to be, probably the highest. And the fact that you don't see plastic surgeons do this is a little bit telling. All right, but let's go over the pros and cons, all right? So pros, it's not surgery. It's minimally invasive. And we know minimally invasive procedures are on the rise. So right there, that's a good pro. Less cost.
Right.
So the cost for threading, I saw things all over the map. Like the cheapest I saw was maybe like $1,200 up to like $2,000-ish for threading. So yes, it's less than surgery because a facelift is going to cost you, $8,000 to $10,000, depending on if you do the neck as well, which is commonly done together. So it's definitely less than surgery. Another pro is that the suture does tend to cause collagen formation, which means that it does give you a little bit of effect even after the sutures go away. So it's not like 100% dependent on the suture, because the sutures do cause increase in collagen, which we know from every advertisement of all face products is a good thing.
Yeah.
Finally, there's minimum downtime. I mean, I did a facelift on Monday, and I tell my facelift patients, I'm like, look, you're going to swell
go out in public for a while.
and you're not going to want to leave your house for like a week, and I'm very upfront about that. With this, I mean, it's not, you don't have that huge amount of time where it's obvious that you had something done. So those are the pros, and those are pretty good pros. But as with everything, there are cons. It is a temporary result.
Yeah.
And to be fair, I mean, you could almost say that about anything. I would say that this one is more temporary than others. I mean, if you go do surgery, like you don't have to repeat surgery, all the time. The non-invasive treatments I like, you do repeat, but you don't necessarily have to repeat them, because that effect, you still get some of that effect for a good time. The treatments I like, things like Morpheus 8 and laser, actually change your skin quality, where this, a lot of the effect comes from the suture, which is temporary.
Yeah.
And that suture could go bad in 6 months, and then it's like, what happened to my result? You said one that's big, asymmetry. What if one suture goes, but the other side stays, and then your face is asymmetric? I mean, that is a potential issue. The one that probably is the biggest for me is infection. These are done in an office. I'll do little stuff in my office, but I always preface everything I do in my office, procedure-wise, with this is not as sterile as if you do in surgery.
So what type of provider is doing this?
Dermatologists, estheticians. I mean,
Okay.
I think there's a fair number of people that do it. I'm not sure. That's a great question. I should have looked that up, Sarah. I'll come back to you.
Because if it's not plastic surgeons, then I would think it would be dermatologists. Or
I'm not even sure dermatologists are doing it. I'm gonna have to look. That's a great question. It doesn't have to be a doctor. It doesn't have to be a doctor. There are non-doctors doing this, which also makes you a little nervous.
like spa places.
Yeah, I think that there is some threading happening in the spas. Yeah, we're not gonna do that at ours. Also, the threads can be visible. You can see like puckering sometimes with the skin, and also you can get sometimes an artificial look to it.
Yeah.
So I mean, to me, honestly, the biggest risk, and the reason that, because I always, when I think about procedures like this, it's like, would I let my wife do this if she came to me and say, hey, I'm gonna go get threading tomorrow? I'd be like, no, absolutely not. Don't do that. Don't do it.
Yeah.
I would worry. The biggest thing is if those things get infected, those threads, it is problematic, because that means you're going to have to potentially cut them out.
Yuck. Which
could be very, very problematic. And I'm not saying that infection is a huge risk for these, because it's not a huge risk, but it is a risk. Mm-hmm. And if that happens, it is a bad problem. So that's my main beef with it. Like the temporary, short-acting potential asymmetry is the other. I'm not saying that if you go get one of these that you're insane or anything like that, or that they're terrible. I just don't like them as much.
They're just not the best option, in your opinion.
In my opinion, they're not.
Yeah.
If you don't want to have surgery, which I think is totally fine, I would lean more towards a laser.
Better things available.
I do like a halo laser or Morpheus.
And they're about the same price.
They are. Yeah, they are about the same price.
And the same.
And you get other benefits too, because things like lasers or Morpheus resurface as well. So you get the skin tightening, but also you get like brighter skin, less pores.
Yeah.
So there's added benefit to that. So
Well,
I'm not
you
high
got
on
me. I don't like it. It just
I'm not-
sounds awful.
I'm not high on the threading as far as like, oh, this is a great thing, and like I'm not gonna offer it in my office.
We added another one to the list.
I would so
BBLs and threading.
if I had to like choose between
don't
getting
go
a
to Florida.
BBL or threading, I probably would take the threading. I would probably take the threading.
I have a question about the threading.
Okay,
So
great.
like when they dissolve or when they come out, do they like fall out or do they just
They
actually
dissolve. They
Okay,
dissolve.
they
Yeah.
dissolve.
Yeah. So when you get surgery, for almost all surgeries, you're gonna have internal sutures, and there's different types of internal sutures. So PDO, which is what these are generally made of, are very, very long lasting. I use some PDO or PDS products which are long lasting. I use some other ones that are short acting, like Vicryl. So those only last like a couple or 3 months. Like these allegedly last longer. It is a little bit variable. Like some
Right.
people just break them down faster.
Right.
But it's not like you don't want them extruding. That's bad. That's your body like rejecting them or infection.
All of a sudden, like,
Yeah,
there's
they start,
just this like thread through the
things
surface
coming
on
down
your
face.
skin.
Yeah, that's bad. I mean, that can happen. Like that's a potential side effect.
Sheesh.
So, I mean, you know, as I said, if you know people that have done threading, and it's not that they made some, you know, really bad decision.
They
I just
did.
personally, it's not my go-to.
Sarah like no, let's not be kind.
Yeah, Sarah's out on threading. But I do want to thank Beth, who suggested that topic for
Great
us.
topic.
Yeah, and I hadn't thought about it because it's not something that I do or I think about that often. And she suggested it, and it was great. And I hope she enjoys the segment.
Oh yeah, speaking of Beth.
Rubbing
the
Buddha's
Buddha.
belly. All right, that's the final thing. We got time for
I
Sarah's
saw,
story.
I saw like on like some type of Instagram, like social media, like news thing, and it was this lady who had been, she is a Buddhist,
Okay.
but not a very good one because she had been worshiping a Buddha that was actually Shrek.
Oh, God.
God. Like her little idol was
Yeah,
Shrek.
her little idol was Shrek.
That is funny.
It was really Shrek.
So how did when somebody like come over and she's like, "This is my Buddha," and like, "That's not Buddha, that's Shrek."
She's probably like, I have no idea what that is.
That's so funny.
Because like if you've seen Shrek,
Right, it kind of has the shape of Buddha. Yeah.
I mean, but if you've seen Shrek, you wouldn't mistake Shrek
Was the Buddha
for
green?
Buddha. Yeah, but a lot of things are green, like the emerald color.
Oh,
you
right.
know?
Like it could be like a jade Buddha, or
Yeah.
it could be Shrek. Oh my gosh, I'm gonna look that up. That's funny.
I was just like,
Okay.
Do better, people. Do better.
bad bye.
Maybe she was worshiping Shrek and not Buddha. Was
Maybe
that
she's
green?
like, get out of my business.
Yeah, exactly right.
Maybe.
It's a really
All right,
good movie.
everybody. If you have a topic you want us to talk about, just leave us a comment on any of our things. Say, hey, I want to learn about X, Y, and Z. I would love to look it up and talk about it for you on the next episode of NipTalk. Thank you guys so much for joining us. Please hit that like and subscribe button, and we'll see you next week.